Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, inside tailor-made leadership programs as nursing homes face rapid administrator turnover. Nursing homes face a growing challenge: rapid turnover of admins, a critical role in ensuring operations run smoothly. Leadership programs, including AIT or Administrator in Training initiatives, are stepping up to address this issue, focusing on building strong leaders through tailored training, cultural alignment, and diverse career pathways. Take Massachusetts-based EF Senior Care, for example. Over the past 4 years, they've graduated 11 AITs, emphasizing both clinical and financial management skills, as success hinges on excelling in these areas. It integrates company culture at every level, fostering leadership from within by engaging staff that have already invested in the organization's mission. Trainees gain behind-the-scenes insight into departments that make a nursing home function, shifting perspectives and preparing them for the complex realities of running a facility, extending training if participants need additional development in specific areas. On the flip side, candidates with advanced backgrounds, such as doctors or RNs, may follow a shortened curriculum. A unique aspect of the program is prepping admins to handle real-world stressors. At the end of the program, trainees may lead challenging situations, like addressing unhappy family members or managing staffing issues. These experiences are critical, given pressures admins have faced in the post-pandemic landscape, dealing with infection control, staffing shortages, financial strain, and much more. Many seasoned leaders have exited the field, leaving a gap tailored programs aim to fill. But building a pipeline of leadership comes with hurdles. Operators need to highlight the industry's benefits to potential candidates, emphasizing job security, the joy of caring for others, and compensation the sector offers is key to attracting new talent. Cost is also a significant barrier. Tight reimbursement rates often make leadership development a low priority. Advocates say federal-level support is needed to ensure resources to grow robust training programs and sustain the sector's future. For the nursing home industry, investing in leadership isn't just about filling roles. It's about fostering resilience and creating a sustainable path forward in a challenging healthcare environment. Next, Nursing Home Group embarks on wastewater research project. A groundbreaking partnership is testing innovative wastewater monitoring tech in nursing homes to predict and potentially control the spread of infectious diseases like COVID, influenza, and RSV. The initiative involves leading-edge LTSS Center at the University of Massachusetts, Boston, a water management firm, and 2 major nursing home providers. Wastewater samples will be used to detect the presence of pathogens in LTC facilities. Research shows this method can identify COVID cases up to 7 days before an outbreak, even catching asymptomatic cases. For nursing homes, where more than 2 million COVID cases have been reported since the pandemic began, early detection could mean faster intervention for residents. Staff at participating facilities receive simple training to collect wastewater samples, which are shipped to the national lab. Results are returned within 8 hours, and the lab provides customized action plans tailored to each nursing home's specific needs. This process enables operators to respond quickly to prevent disease spread. The study will also examine how the system impacts staff behavior and infection control practices in LTC. While the initial focus is on familiar diseases, researchers are expanding monitoring capabilities to detect emerging pathogens and MDROs, offering broader applications for the technology. By harnessing wastewater analysis, this partnership aims to create safer environments for the nation's most vulnerable populations. And at last, CMS proposes Medicare Advantage Guardrails, or MA Guardrails. CMS is taking action to address concerns about MA plans, proposing new limits on the use of prior authorizations and AI tools acting as barriers to care. These reforms come in response to growing complaints from consumers, healthcare providers, and Congress. Widespread use of prior authorizations, which insurers claim help manage costs. Data shows that MA plans overturn about 80% of denied claims when appealed, and less than 4% of those denials are actually challenged, suggesting that many more claims could be wrongfully denied and never corrected. No senior or person with disabilities on Medicare should face obstacles to life-saving meds, necessary inpatient care, or rehab services. Skilled nursing providers have long warned that MA coverage decisions, often guided by AI and other algorithms, can deny or prematurely end care, putting patients and Medicare funding at risk. CMS aims to curb these practices, emphasizing healthcare decisions that should prioritize patient needs over cost-cutting algorithms. CMS plans to enhance consumer protections and promote competition among MA and Part D plans. Proposed policies will increase transparency, hold insurers accountable, and address misleading marketing practices. New tools on Medicare.gov will help consumers make better informed decisions about coverage. The ultimate goal to ensure everyone enrolled in MA and Part D plans has access to high-quality, timely care without the unnecessary barriers. The proposed rule, if finalized, marks a significant step towards improving healthcare access and equity for millions of Americans. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your quality improvement needs, call the Q.